to understand where is this border, you should know exactly where is inferior border of the lung. Why? To know the level of diaphragm. If we have normal border, you should check this border of relative heart dullness in the fourth intercostal space. If this border is lower than normal, what is about this right border of relative heart dullness? Also, fourth and third intercostal space, if higher than normal. Sometimes, if we have decreased resonant sound in the fourth intercostal space, it is not possible to check this right border in the fourth intercostal space, because you should go from resonant to decreased resonant sound. If we have decreased resonant sound in this level, it is not possible to check border in this intercostal space. Look, another situation. For example, we have liquid in our pleural cavity. Dull sound. Is it possible to check this right border? No, it is not. That's why we should know exactly where is inferior border of the lung to know the level of diaphragm. Okay? That's why. Quiet percussion. Mark first, second, third, fourth, fifth, sixth rib. It's normal. That's why you can check this fourth intercostal space. 3, 4. Fourth intercostal space, right border of relative heart dullness. My finger is parallel to the border. Small steps, quiet percussion. Decrease resonance, mark. 1 centimeter externally of the right sternum edge. Yes? Is it normal? It's normal. It's right atrium. 1, 2, 3. Third intercostal space. Maybe 0.5 centimeters externally of the right sternum edge. It's right atrium. That's all about right border of relative heart dullness. Left border. First of all, you should palpate apical impulse. First of all, visually, like this and this. If you see pulsation, it's possible to palpate. If not, first of all, position of your finger. 4th, 5th, and 6th intercostal space, and after that, localize. And I feel this pulsation, and after that, characteristics of the apical impulse. Yes? Do you remember? Force, amplitude, diameter. Okay. If I feel this apical impulse, I should go 2 centimeters externally, and I'll use percussion. If not, I should start from anterior axillary line. And mark. It's the point of apical impulse. It's the apex of left ventricle. 4th intercostal space. And mark. Maybe 2.5 centimeters internally. Clavicular line. It's the left ventricle. 2, maybe 3 centimeters externally on the left sternum edge. It's left atrium. After that, superior border of relative heart dullness, parasternal line. Steps larger than here, because we should go choose 2 intercostal spaces. It's difficult. Try it. It's difficult to understand. Maybe I will be quieter. It's difficult because I want to hear decreased resonance sound. That's why I should have this border in the third intercostal space, but I have not. Is it possible? Yes, it's possible. Sometimes it's a problem to hear. That's why we use not only general inspection. Sometimes it's important to, or percussion, or palpation. Sometimes, not sometimes, always we should use auscultation and sometimes instrumental methods. Okay. Okay. Absolute hot dullness. It's the borders. Superior border of relative hot dullness, left atrium. Absolute hot dullness. It's the borders of right ventricle. That's why these borders. It's the borders of the heart. It's a part of the heart which doesn't cover all the lungs. That's why, first of all, borders of relative hot dullness. We have 3 points for these borders: fourth, fifth intercostal space, and our superior border. That's why, first of all, if you have question, right border of absolute hot dullness, you should do 3 steps: inferior border of the lung, right border of relative hot dullness, and after that absolute. Here, 1, 2, 3, 4. Quiet percussion, and after that very quiet. It's the left edge of the sternum. Why here? Because sternum doesn't give us dull sound. Left border. First of all, apical impulse, after that relative hot dullness. Yeah. And after that very quiet percussion. Maybe here. Absolute. And after that superior, but we don't know where is relative. Maybe here, absolute. Small area of this right ventricle. Now, how often we use this percussion for absolute hot dullness? Every day, every week. What do you think?
When you suspect dilation or hypertrophy.
That's why, if we suspect dilation, how can we suspect? Epigastrial pulsation, or maybe jugular vein dilation. That's why we should use this percussion, maybe once a year. That's why we have echocardiography to check. That's why it is not important to use. It is not. I think that it's borders of absolute hot dullness. We use borders of relative hot dullness, but absolute, it is not clear. That's why. That's all. Auscultation.